Have you ever noticed that your cat, the one who usually greets you like a small, hungry ambassador, suddenly walks past her bowl as if it belonged to someone else? One day everything is normal, the next day the bowl sits full and the house feels quieter. A cat refusing food is not just annoying. It is one of the clearest signals that something in the cat's body or world has changed. In this video we will go through the real reasons cats stop eating, how to tell which cases are emergencies, and practical steps you can take to help your cat feel hungry again and stay healthy. To start, it helps to understand that eating is an intersection of physical sensation, habit, and mood. For humans, eating is often driven by routine, taste, and social cues. For cats, food is also about smell, texture, and safety. If any of those signals is altered, a cat can simply lose interest. A blocked nose can turn a gourmet into a disinterested diner. A painful mouth can make chewing unbearable. Even subtle changes at home can turn a confident eater into a picky observer. So when appetite changes, it is rarely meaningless. Appetite is a window into the cat's entire state. One of the most common explanations is dental pain. Cats hide pain exceptionally well. A small toothache, inflamed gums, or a broken tooth may not be obvious at a glance, but each bite becomes an unpleasant negotiation. Cats with dental issues may try to crush or lick food rather than chew it. They may drop kibbles or leave lumps of wet food untouched. Watch for subtle signs: increased drooling, pouring at the mouth, bad breath, or a preference for softer food. If a cat used to crunch through biscuits suddenly chooses pate, dental discomfort is a strong suspect. A veterinary dental check is not dramatic. It may be the difference between a slow decline and a quick recovery. Then there are gastrointestinal problems. Nausea, inflammation of the stomach, or a gut upset can blunt appetite immediately. Nausea is a sensation that humans can describe, but cats cannot. They react by avoiding food, sometimes grooming more to soothe their stomach, sometimes hiding. Vomiting, diarrhea, or marked changes in litter box habits alongside food refusal point toward the digestive tract. Gastroenteritis, parasites, or even a sudden change in diet can trigger this. For example, a well-meaning owner who quickly switches brand or type of food might inadvertently cause a short-term reluctance to eat. When the digestive system rebels, the answer is often a vet visit and a careful plan of slow reintroduction to mild, bland food. Systemic illnesses are more serious but unfortunately also common causes. Hyperthyroidism, kidney disease, liver problems, and certain cancers can all reduce appetite. Many of these conditions are more likely in older cats, but younger cats are not immune. The way to think about it is that the body is operating under stress or dysfunction and food becomes less important than the hard work of dealing with sickness. In many cases the cat will also show other signs: weight loss over time, increased thirst, changes in urination, lethargy, or changes in behavior. That is why a sudden or sustained refusal to eat in an adult or senior cat should be treated as a red flag. Blood work and a veterinary examination will reveal information the eye cannot see. Another surprising cause is stress and environmental change. Cats are creatures of habit, and the environment matters to them in ways that may seem exaggerated to us. A new neighbor's dog, remodeling work, a visitor in the house, the arrival of a baby, or even a change in where the litter box is placed can upset a cat so much that food loses its appeal. In multicat households, social stressors like bullying or competition at the bowl can also reduce eating. If a cat feels unsafe while eating, it will either avoid the food or eat in small, hurried amounts. Solutions here are about restoring calm, separate feeding stations, quieter areas for eating, gradual introductions for new household members, and scent exchange to reassure a stressed cat. Medication and toxins deserve special attention. Many drugs cause nausea or reduce appetite as a side effect. Even a seemingly harmless supplement can produce digestive upset in a sensitive individual. Household toxins, plants, chemicals, or human foods that are toxic to cats can also lead to food refusal and, importantly, medical emergencies. If a cat shows food refusal along with drooling, tremors, vomiting, or disorientation, assume intoxication until proven otherwise and consult a vet immediately. A category that often gets overlooked is changes in the food itself. Cats are famously sensitive to changes in texture, brand, or even the way food is presented. A new batch of commercial food might have a slightly different fat profile or different aroma. Or the owner may have switched from one protein to another. Cats also form connections between the bowl and the location. If the bowl is moved near the laundry machine or in a drafty area, the cat may choose to avoid it. The solution is simple but often neglected: check packaging, check expiration dates, and if you introduce something new, revert to the old favorite slowly. Picky eating and learned behavior are another piece of the puzzle. Some cats are naturally choosy. Others learn finicky habits because they are constantly rewarded for selective behavior. If at the first sign of disinterest the owner offers a high-value treat, the cat learns that being picky is a successful strategy. Over time this becomes a pattern that looks like appetite loss but is actually strategic preference. The remedy is patience and consistent feeding rules. Offer the regular food, avoid constant treat bargaining, and make mealtimes predictable. Age matters a great deal. Kittens and young adults usually have robust appetites, but when a cat ages, several changes can occur. Dental disease becomes more common, as do chronic conditions such as kidney disease. An older cat that stops eating needs urgent attention because they are at higher risk for hepatic lipidosis, a dangerous liver condition that can develop when a cat stops eating for more than a few days. This condition is unique to cats because their metabolism handles fat very differently. The liver starts to overwork and fat accumulates in liver cells. The result is a rapid decline that can be extremely difficult to reverse. In older cats, quick veterinary assessment and intervention may be life-saving. Let us talk about how to triage the situation at home the moment you notice the food avoidance. First, observe. Note whether the cat is completely refusing all food, only refusing dry food, or taking small tastes. Check the cat's water intake. Is the cat grooming normally? Is there vomiting or diarrhea? Are there any signs of pain when you touch the mouth or body? If the cat is behaving normally otherwise, confident and active, you may have time for a veterinary appointment within a day or two. If the cat is lethargic, vomiting, showing signs of pain, or the refusal has gone on for more than 24 to 48 hours, treat it as urgent. Kittens, tiny cats, and older cats demand faster action because they dehydrate and develop metabolic complications faster. When you decide to act, a practical plan helps. If you suspect dental pain, try offering a small amount of soft, warmed food. Heat releases aromas and makes the food more appealing. If the cat eats warmed food, that may confirm that texture or smell was an issue. But do not use this as a long-term solution without investigating the dental cause. If you suspect nausea or an upset stomach, a veterinary-recommended bland diet or a short fast under vet supervision may help reset the gut. Never give human anti-nausea medication without veterinary guidance. The environment is also part of the solution. Make the eating area as appealing as possible. Place bowls in quiet, stable locations, away from loud appliances and heavy foot traffic. Consider elevated feeding stations if anxiety from other animals is an issue. Use wider bowls if whisker stress is a factor. Some cats avoid narrow dishes because the whiskers brush the sides. Keep food and water separate, as many cats prefer their water stations away from their food bowls. Clean bowls regularly. A tired, obviously dirty bowl is a good reason for a cat to move on. If learned pickiness is the problem, restructure feeding routine. Use scheduled meals rather than free feeding. Withhold treats for periods and remove food for 15 to 30 minutes if the cat refuses. Reintroduce food at set times. For cats that have learned to hold out for high-value snacks, a reset period of consistent non-reward for pickiness will help. Patience matters because the cat learns that a calm approach will yield food rather than drama. When behavior is more stubborn, appetite stimulants can be part of the veterinary toolkit. Medications like mirtazapine or certain appetite stimulants can be prescribed for short periods to help a cat start eating again while underlying causes are addressed. These are tools for stabilization, not long-term fixes. Veterinary guidance is essential because stimulants have side effects and interactions with other medications. Supplemental feeding is the next step for severe or prolonged refusal. Syringe feeding or using palatable, high-calorie veterinary diets can keep a cat alive while diagnostic work is ongoing. Many owners find syringe feeding stressful, and it can be for the cat too, but when guided by a vet it is often necessary. Nursing a cat through a period of unwillingness to eat requires a gentle hand and a plan. Work with your vet to choose a formula, a feeding schedule, and a technique that minimizes stress. Prevention is, as always, better than reaction. Regular veterinary checkups, dental cleanings, and consistent routines will make food refusal less likely. Keep a food log if your cat is older or has chronic conditions. Note changes in appetite immediately and be proactive. A small checkup early can save a lot of trouble later. Keep high-value food only as an occasional treat, not as a substitute for regular meals. And keep the environment calm and predictable. Cats are subtle creatures. The small things we overlook can have big effects on their appetite. Finally, let us underscore the emotional component. For many pet owners, a cat refusing food is deeply upsetting. It triggers worry and the urge to fix the problem quickly. That is natural. Remember that cats sense our energy. Staying calm, organized and methodical will help you make good choices for your cat. Observe, document what you see, and give your veterinarian as much information as possible. Notes about when the appetite changed, what the cat is willing to try, and any accompanying symptoms will make diagnostics faster and more effective. So what are the key takeaways? Appetite changes are never trivial. A short pause in eating can be harmless, especially if it resolves quickly and the cat otherwise behaves normally. But in kittens, older cats, or when the refusal lasts more than a day or two, seek veterinary care. Look for clues in the mouth, the litter box, and in social interactions at home. Make the eating environment welcoming, warm food where appropriate, and avoid rewarding picky behavior. Use veterinary tools like diagnostics, appetite stimulants, or supplemental feeding when required. And finally, keep perspective. Early action and calm decision-making will give your cat the best possible chance for a full recovery. If you found this helpful, consider subscribing to Catopedia for more straightforward, science-based explanations about common cat problems. Leave a comment below with your experience. Have you ever nursed a cat back to appetite? What worked and what did not? Other cat owners will learn from your story. Thank you for watching, and give your cat a gentle scratch for me.